Okay, so we've got to go over how big PPE is and how it's, as much as we'd like to think it's just going to fall off a cliff, it probably won't. And how you managed to put new machines in, get them running, and are really answering a major part of this pandemic. And it's not over, correct?
That's correct, Jim.
How much more do we need?
So here's what we've done, Jim. So when we talked back in March, we had existing production lines, and I got to give credit to our teammates. We had people on the line workers themselves. We had management. We looked at it, and we tried to find ways to increase production off of those machines. And again, I'll give credit to all those teams. And we found ways to increase production off of those lines. For example, N95s, an additional 10%, 20%, 30%, 40%, 50%. And that enabled us to increase our production from back in March to where we are today. We continue to analyze that. We continue to have a focus on process improvement, additional output, and manufacturing efficiency. Because even today, there's still an imbalance between demand and supply in the marketplace.
Now, if I were running the show, the healthcare show in the United States, I would call you, and I know the government gave you some money. I would say we need a supply of 10 billion masks just in warehouses and refresh it if they go bad. We can never have a shortage again. Will we do that?
Jim, I actually think it's a little bit of combination of stockpile and storage in addition to that excess capacity. So that way you have the ability when the initial surge comes to use that stockpile to replenish the system. And then while that continues, you have the ability to take that excess capacity that exists to produce. So one of the things we've done is, as you stated earlier, we got some funding. We added incremental machines in the United States. We have manufacturing capabilities in Lexington, North Carolina that makes all the fabric used for masks, isolation gowns, surgical gowns, N95s. We have new lines up and running in Del Rio, Texas. And here's what else we did. Since we manufacture products ourselves already and understand the process, we originally thought it would take about 6 months to get those machines up and running. So we're looking the end of October. And as I stated last week, I'm excited and proud that we actually are starting to get product coming off of those lines already. So just in several months and ahead of schedule. And again, that's going to enable us to provide more product to the U.S. market, to the healthcare, to help with the stockpile. And that's really what I think you have to do to make sure that we get through this issue as well as continue to have capabilities going forward should this happen again.
Don't miss a second of Mad Money. Follow @JimCramer on Twitter. Have a question? Tweet Kramer. #MadTweets. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.